Oh, sorry. I can't help it. Oh, seriously, it's too good. It's too good. I love it. OK, take it away. Take it away. I can't control myself.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Here she is, the puppy with the best haircut in town.
You're a good boy. Are you so clever?
Known as a nation of animal lovers, the UK is home to 36 million household pets, 12.5 million cats, 13.5 million dogs, and not to mention all the other creatures, great and small, that we welcome into our families.
And in this new series, we'll be finding out what happens when our fur-legged friends are in need.
I'll meet their devoted owners and the expert staff who treat them, from the routine
Blooming brilliant, aren't they?
to the life-saving and everything else in between.
I could sit here all day and talk to these doggies.
We'll capture the intense bond between owners,
Hello, darling. Hello, sweetheart.
animals, and the vets.
Good boy. Well done.
And I learn about a rescue centre that's finding new homes for animals in need.
Morning.
Anyone that's thinking about adopting is definitely a really rewarding thing to do and gives a dog or a cat a lovely home.
So, join me, Fern Britain, on a roller coaster of emotions inside the vets.
I'm back at the Grove Vets in the Bristol suburb of Henleaze, where husband and wife team Andy and Amy Valencia and their friend and colleague, Dr. James Greenwood, have welcomed me in. Along with their team of veterinary nurses, they've introduced me to their furry patients and their loving owners.
All right, Lars?
I'm really enjoying finding out at first hand what it's like to be inside the vets.
Oh, thank you very much.
Our pets are so important to us that whenever they're not well, we always want the very best treatment for them. Diagnosing exactly what's wrong and how to treat the problem is down to the skill and care of the vets.
This on its own is not enough information, so we're going to do one more X-ray, and then we're going to do an ultrasound scan, and then we need to make a judgment call.
There we go, Arthur. You'll be okay, won't you, bud? There we go. Let's get you in.
Hi, Greenie.
Hello. Arthur.
Perfect. I'll mark you in and we'll be with you shortly. Just grab a
Thank
seat.
you.
Meet 12-year-old rescue cat Arthur with his owner Karina.
Arthur came into our life from an animal sanctuary just outside Bristol. We adopted him after seeing him in their adverts, really. He was diagnosed with feline diabetes, and they made that very plain on his adoption form. There was something about the pre-diagnosed condition that kind of made you want to help out if you could.
Hi.
Hello
You
there.
got Arthur?
Hi. Yes, I
Do you want
have.
to come on
yes.
through?
Thank you very much.
It's estimated that about 1 in 200 cats has diabetes.
Come on in.
That's over 60,000 cats in the UK. Vet James is in charge of Arthur's case.
Ah, hello.
So, Arthur
Yep.
is a diabetic.
Oh,
Here he is.
he's very handsome.
He's
he is.
gorgeous.
He is, and this fluffiness is gorgeous.
On the whole, he has been stable in the past, but his diabetes has hit a bit of a rocky patch again. So we are monitoring and trying to work out what his glucose levels are doing.
And to help with that, James is using the latest tech.
This is what we call a Freestyle Libra. So this is a new bit of kit. What this does is connects to Karina's phone, and it will actually read Arthur's blood glucose levels
Wow.
over 24 hours.
I've seen these on humans.
Yeah.
Right.
But yeah, they are amazing.
Oh, and diabetes is something that older cats get, or?
So diabetes in cats is relatively common. So it's basically where There's either not enough insulin being produced or the body isn't responding to the insulin in the normal way, which basically means that they can't control their own blood sugar levels. So very similar to how we see with people, it means that we end up most of the time injecting them then with insulin.
Insulin is a hormone that helps us and all mammals to regulate blood sugar levels.
You have to administer that, do you?
Yes, so twice a day by syringe.
Oh, and he tolerates that.
Yeah, he was very good actually. Yeah, when we adopted him, his foster care had got him quite used to it, but I think from day 0 he was fairly good with it.
Arthur's clever gadget monitors his blood sugar 24 hours a day.
Traditionally, we'd have had to try and measure his blood sugar levels using a blood test, so we'd have to actually take physical
like
blood.
the prick test. Yeah,
Exactly, so we can do a prick test on the edge of their ear, or you can take a normal blood test with a needle and syringe. But in order to understand what insulin, the effect the insulin is having on the body, you have to take probably at least 6 or 7, maybe even up to 8 or 9 blood tests over one day. So you can imagine for a cat coming into the vet's hospital, having all those tests taken, it's pretty stressful. And the difficulty is that stress will actually push sugar levels up just because they're stressed. Whereas the beauty with this is that we apply it here and then we get a very realistic reading of his blood glucose levels.
Amazing. But this is a full-time job for you then?
Yes.
2 jabs a day. That's a big...
It's a big commitment.
Yeah.
Yes, it is a commitment, yeah.
Yeah.
But on the other hand, look at him, he's gorgeous.
I know, he's a lovely cat, yeah, and he's been a great cat to have around, but
We'll just see what his weight's doing.
that's interesting, yeah.
Good boy.
Yeah, settle down on the yes.
3.89.
He's a good lad.
In the summer, he loves being outside. He just loves being with people. He particularly endeared himself to my husband, who previously was a bit of a dog person. But so I don't know if there's a thing there, but...
Cats will always win you around. Yeah.
Yeah, he loves him to bits and just kind of will sit there and often I'll come home and get kind of like, oh, Arthur and I have been watching the football. I don't know whether you're mad or whether this is the truth.
Crack open
He'll
a
kill
couple
me,
of
no.
beers on the footy and the lads are asleep. Yeah, good on him.
Yeah, but...
So the good news, his weight has gone up a little bit.
Oh, okay,
so
that's
he was
good.
3.58, he's now 3.89. And eating-wise, is he eating steadily as well?
He does like to graze, so we got it down to sort of 4 meals a day, 2 bigger ones when he had his injection, and 2 more snacky ones.
When we give the injection of insulin, of course, if he has that on a completely empty stomach, then his blood sugar levels are going to drop dangerously low. So we need to always time the insulin with food, but lots of cats prefer to feed on their own terms. They, they just like to sort
I
of
love that. We've got it down to 4 meals. And I think, I smiled. I understand that.
Yeah.
Okay, let's have a little look at your results then, Arthur.
The app on Karina's phone allows her to print out graphs showing the ups and downs of Arthur's blood sugar level over recent days.
And you can see it spiking up and down, up and down, up and down. And that correlates both with the insulin wearing off, but then also he's going to have food. So where you can see this curve going up to the top, it's where the insulin's worn off, so that's where he needs another dose of insulin.
The aim of the treatment is to moderate Arthur's blood sugar level and make it less erratic.
If we leave diabetes untreated, it can lead to secondary problems, things like cataracts, but in worst case scenario, it can actually put them into a coma. So what we're trying to do is keep them in a nice band in the middle. One thing that we could maybe do is run a blood test looking at something called fructosamine, which is almost like a historical test. So it tells us what the blood sugar levels have been doing on average over the last 3 weeks, which is quite a nice way to kind of look back and go, on average, have we had good glucose control?
That's incredible.
Yeah. So I think that might be quite a good thing for us to do today, if you're happy with that.
Yeah, absolutely, yeah. I think it would be a good thing. Is he going to climb in, Matt?
You might, yeah.
Do you want to see if you can get back in your... No, it's pretty chill. Oh, here we go. Yeah. He's like, actually, okay.
He does it in his own time.
Absolutely.
Yes, that's cats.
As he should.
Ably assisted by vet nurse Alice, James collects the blood sample from Arthur.
Your hand is actually beautifully positioned for me to lean on.
Glad I can help.
Thank you.
He's such a good cat.
James is hoping that lab tests on this blood sample will give him a better picture of Arthur's blood sugar levels over the past 3 weeks.
Okay, here we go. Right, lovely. We'll get those bloods sent away and we'll give you the recall results and then we'll go from there. All right, okay, we'll speak to you soon. Take care. Bye.
Next to see the vets today is Sarah with her King Charles Spaniel.
Morning. Who have we got here?
Eddie.
Lovely. If you'd like to take a seat, I'll be with you shortly to admit him.
Thank you.
Vet nurse Ella checks in 8-year-old Eddie for a biopsy.
Good boy. How is Eddie today?
He's all well.
Hi, pal. Good stuff. Okay, so today we've got Eddie in for a general anaesthetic and a little lump removal on his chest. Is that right?
Yeah.
All righty, bless him. What we'll do then is we'll take him on through, get him all settled in a kennel, and we'll give you a call with an update when we can.
Good boy.
He's lovely. We'll take him out the back then and get him sorted. All righty.
Right, baby.
We'll give you a call when we can.
Thank you. All right.
Good boy. Good boy.
I'm keen to learn more about why Sarah brought Eddie to the vets in the first place.
How did you find the lump?
It was like a little marble. Just could feel it under his skin. Didn't sort of feel attached to anything. So it kind of didn't worry me, to be honest. It was only Amy that said, well, without testing it.
Yeah, because you've known Amy for a while, haven't you?
Yeah, since we've had Ed, we followed them here.
Oh.
Complete trust in them.
Tell me about him as a personality.
He's a cheeky chappy.
Is he?
Always has the last word.
As Eddie is Amy's patient, she'll be performing the surgery to remove the lump.
We've seen him a couple of times and we've tried doing a few tests beforehand to try and work out what the lump was, whether it was a benign lump or a malignant lump, but unfortunately that came back inconclusive. Eddie is at the age where we start to be a bit more worried about more complicated things creeping in.
Eddie was originally owned by Sarah's son, Michael, who tragically died from a brain tumour in his teens.
He's definitely very special in Sarah's family. So he was Sarah's son's dog, who unfortunately isn't with us anymore. So definitely means a lot to Sarah and definitely meant a lot to her son Michael as well and helped him through a lot. So yeah, I mean, all of our patients are very special to everybody, but he in particular is very special to Sarah.
Uh-oh. Vet bills? Don't worry, Dad. I'll eat them. Ha ha. See you later.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Oh, I thought we were here about my allergies. No, it's fine. It can be about you.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
At the vets, Amy is leading the surgery to remove a lump from Eddie, a King Charles Spaniel.
So he's had some sedatives just to make him a little bit sleepy so he's less aware of what's going on.
Nice and relaxed.
Nice and relaxed, yeah.
So what's going
What
on
I'm
there?
giving now is the general anaesthetic.
Okay.
So this will go into his vein and will knock him out. So he's quite sleepy now.
How do you know?
So we're looking for reflexes. So most of his reflexes will disappear when he's under an anaesthetic.
Oh, okay. He's not in any distress. He probably
No,
doesn't
he's
even
fast
know what's
asleep.
happening.
He's a bit snore. He's just having a
So-
nice little snore. He's fast asleep.
That's snoring, not growling.
It is snoring, yeah. Well,
So you've kept
happy
him
to
nice and
discuss.
warm.
So yes,
Can I give
he's
him a
nice
little-
and warm.
I'm not scrubbed up because we're not actually in
We're
the
not
theatre
sterile
yet.
yet, no.
Okay. And when did you find his lump?
So his owners noticed it a few weeks ago, and they were keen not to have to operate on him unless we really needed to. So we did a couple of investigations to try and work out whether this little lump here on his neck is maybe about the size of a blueberry.
Without a laboratory test, it's impossible to know if Eddie's lump is benign or malignant.
So a benign lump's a lump that we don't need to worry about. It is a lump, but it's not going to spread elsewhere.
Yeah.
It's not going to...
Just part of the ageing process.
Yes. Whereas a malignant lump would be sort of a cancer that's going to spread elsewhere and cause problems. So we'll cut it out today, and then we'll send the entire lump to our external lab, and they'll have a look at it under a microscope to tell us then exactly what the lump is.
Okay.
Whether
And
it's...
then any further treatment
We would
talk
then
about
talk
from
about
then?
afterwards, yeah.
Okay. As a pet owner, when you do, and you're stroking the cat, the dog, whatever,
Yeah.
and you find a little lump, feel something, when is it important that you think, I must have this investigated?
So I would always get it checked.
Straight away.
So I would always go and see a vet. I think the difficult thing is that to me and to you, a lump is a lump until we start investigating it. So it's always worth having it checked by a vet and then those further investigations to work that out.
The weight of what you're doing is huge because for the pet owner who's waiting, I mean, this animal is everything, part of the family.
Yes. It is very much at the forefront of our minds when we're in a consultation talking to those owners and to the families.
Because you've known Eddie all his life.
Yeah, so we first knew him as a young puppy. So yes, he's a lovely dog, and he's definitely seen his family through a lot, which makes him extra special for them.
Amy shaves the area around Eddie's lump, ready for the operation.
Even this bit you have to do with infinite care.
Well, it's the bit that the owners see, so they like a neat clip. Maybe a little hoover.
Anything to keep the surgery nice and tidy.
He's a lovely boy, isn't he?
Eddie's in safe hands as they finish his surgical prep before he's transferred to the theatre. The Grove Vets sees a lot of rescue animals through its doors. Rescue centres allow people to give an animal the chance of a new home and a new life. And when the cat or dog comes from abroad, that can come with extra responsibilities. Martin, who originally came to Bristol from Northern Ireland, adopted his rescue dog, Barney, from Macedonia.
Hello.
You got Barney?
Yes, got Barney.
Amazing.
Good boy. Sit down. Sit.
Today, Martin has brought Barney to be castrated, a requirement of his being adopted from the rescue centre. Because he came from overseas, Barney also had to be tested for the bacterial disease brucellosis before he could be adopted by Martin.
I got Barney last March, almost a year now, and he's been great. He's pulled all the heartstrings, so he has, and I love him to bits, and looking forward to spending many happy years with him.
Barney will be under the care of head nurse Ella and vet James.
So this is Barney. He is a little rescue dog that's come down for a castration today. So we're going to be doing the operation, and then that involves taking away his testicles. And then he'll have the surgical site stitched up. He'll go home and recover, hopefully. In the next sort of 5 to 7 days, he should be totally unaware that anything's happened. There's lots of benefits to castrating dogs, but in Barney's case, this is actually a requirement of his rescue charity as well. There we go. We don't always recommend castrating every single dog, but for those dogs that are perhaps oversexed, so they are humping lots, they may be roaming to try and reach other dogs, then yes, neutering them can really help. So in Barney's case, he is at an age where he is sexually mature, so it hopefully will help take some of those, should we say, desires down a little bit as well. Good boy.
Before the operation begins, James injects Barney with an anaesthetic. They also use an anaesthetic gas to make sure he remains fully unconscious.
There you go. So that's the tube just going down his windpipe. So we can connect that up to anaesthetic, and then that will keep him nicely asleep for us. Happy?
Yeah.
Cool.
Oh, good.
Delicate procedure. Right. That's looking good.
Barney is carried to the operating theatre while James prepares for surgery.
we're going in. So I've pushed the testicle forwards. So we make the incision just in front of the scrotum, and then that helps with healing. And then you basically just carefully go through each of the layers until we can get the testicle out.
Ella monitors Barney's vitals during the operation, which will take about 25 minutes.
How's he doing? Is he okay your end?
Yeah, all good.
How's his blood pressure?
Yeah, good.
What's it reading?
120 over 70.
Oh, nice.
So,
Okay.
nice. It's a good. What I like to see.
Yeah, good. So this will be the first ball coming off. So I'm going to make the cut between the two clamps, and then that will free the first testicle. We just got to do all again now for number 2. So that's the last stitch, Ella.
Perfect. Yeah, blood pressure is good. So.
Good. There we go. Done. Right, let's wake him up. 3 swabs, 1 blade, 1 needle, all accounted for.
I'll just slowly start waking up.
Yeah. Good boy.
Once Barney starts to come round, he's moved to recovery.
If you want to go ahead.
This operation has fulfilled owner Martin's obligation to the rescue charity, and now they can both start to look forward to their future together.
I didn't have experience with a male dog, been castrated before, and I thought it was going to be a lot worse than it was. I didn't feel a thing. It's been plain sailing, really.
While James has been taking good care of Barney, Amy is preparing to operate on much-loved spaniel Eddie to remove the suspect lump. As this is a minor operation, I don't need to scrub in or wear a mask.
How's his anaesthetic depth, Ella?
Yeah,
okay.
He's good to cut.
Happy if I cut?
Yeah.
Yeah. So I'm just going to start cutting now.
Yes.
So we make a little elliptical incision around the lump through the skin. And because I don't know exactly what this lump is, I'm taking a fair margin of normal tissue around the outside of it.
So you don't want to actually puncture that
No,
in case
so you,
anything escapes?
so you want to take the lump in its entirety and hopefully with a bit of normal tissue around the outside. The cancer cells can be in the local tissue but not part of the main lump. So you just want to take out enough tissue that it's unlikely that you're going to leave any of those potential cancer cells behind.
You're all right there, darling. When you wake up, it'll be gone. There we are, getting that out. Whatever it is. You've done lots of these, I suppose.
Quite a few,
Are they
yes.
quite common?
Lumps are very common, yeah. Some are more straightforward than others. Now it's about closing up the defect, really.
And those will be dissolvable?
So these are all dissolvable stitches going in now, yeah.
And then how long does that last before you know the wound is fixed?
About 10 days time.
10 days.
Yeah, 10 days that we will be totally healed. So Eddie will have to be walked in a controlled way for the next 10 days. So he'll just go out for walks, but staying on the lead. We don't want him to do too much that might risk bursting his stitches open.
Yeah.
Which in the long run will mean a much quicker recovery time. So Eddie can get back to doing what he wants to do, his normal life more quickly. So yeah, so this will be the last stitch now.
He's remained stable, really, hasn't he?
He has, which is what we like.
Yes, no drama. So lovely to see the respect that you are giving them.
Yeah, absolutely. I mean, we want them to be comfortable, and as we've been saying, they're part of our families. So
yeah,
so There we go. So we'll now take the clamps off.
Well done. Be interesting to see how he wakes up. How do you do that?
We just allow him a little bit of time to settle here with the inhaled anaesthetic turned off, but with some oxygen. And then when he starts to swallow, we'll be able to take his tube out, and then we'll carry him through to our kennels where he'll recover with the nursing team, cozied up. It's important to keep him warm.
It's crucial to keep Eddie warm after the surgery because the anaesthetic makes it harder for animals to regulate their own temperature.
And we like to keep hold of them for a couple of hours just to keep an eye on them, make sure that they're well recovered from their anaesthetic and that there aren't going to be any complications from the point of view of the anaesthesia. Yeah.
The lump itself is stored in a special preservative and will be sent for tests.
So then that will be picked up tonight by the couriers from the lab, and they'll process that and we'll get the results back in a few days.
All of this is going to be a huge bill.
Yes.
Yes.
It's always a relief, to be honest, when pets are insured, because although there are still financial considerations, there's something to fall back on.
Still to come, James and I meet the Grove's newest patient.
Right, let's pop her onto here and see if she'll sit. Oh, straight off.
Good boy. Right, we're going to stay there?
And we venture outside the vets to meet animals getting a second chance of living their best lives.
Anyone that's thinking about adoption is definitely a really rewarding thing to do and gives a dog or a cat a lovely home.
Ah, stung by a bee. Don't judge me. It'll probably happen again.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Uh-oh. Vet bills. Don't worry, Dad. I'll eat them. Ha ha. See you later.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Barney, wanna go in the garden?
In Bristol, rescue dog Barney is recovering at home after his castration.
Go on, buddy.
His owner, Martin, adopted him a year ago.
Come on. Barney stood out for me, so he did. His beautiful eyes, they were just piercing and they just made me fall in love with him. That's a good boy. Stop. And we just looked into each other's souls. I picked him up and we looked into each other's souls. And it was just amazing, so it was. And he's been my little buddy ever since. Come on. Whee.
10 days after Barney's castration, Martin brings him back to see James. The hope is that his wound has been healing up nicely.
Hello.
Hello.
Got Barney?
Yes.
Look at you. Do you want to come on through?
Thank you. Come on, Barney.
Come on in. Look at him, all handsome. I'll just shut the door behind us. Right, is he happy up on the table?
I think he should be fine with that, yeah.
Okay, should we pop him up then and we'll have a little look? How's he been since the operation?
He's been great. He's bounced back. He's
hello.
And bubbly self again.
Oh, hello. Look at you. He's such a good boy, aren't you? Right, what we need to do today, I'm going to have a little look at what the wound's looking like. If you're happy to just have a little hold of maybe up of his collar here, because I'm going to have to go to his slightly private parts. And I'll just have a little look back here, okay, if you're happy. Hello. You can let me have a little look under here? Okay, so just where that final little knot of suture material is healing up, there is just a little knot there, which is sort of poking a little bit through the skin. The wound itself has healed up really beautifully. So I'm just wondering whether we just try and nick that out with a little bit of a scalpel, because he's such a good boy. He is. I think he probably would let us do it. Should we have a little go then? If you want to pop him onto your lap, that might work quite well because he's quite relaxed. So if you want to just take him down to there. Let's have a look here. If I just come down here, let's see.
He's a good boy.
There, beautiful.
Good boy.
There you go.
Oh, wow.
Oh, what's that? So that's just going to help that last little bit heal up. So if you just keep an eye on it at home, and as long as it just turns back to the normal salmon pink colour of the rest of the wound, then it's all fine.
With the final stitch removed, Barney will be able to heal fully.
keep it clean, keep him from licking at it, just keep him rested for a few more days, and it should heal up beautifully on its own.
Okay, great.
All right?
Thank you.
Well done, Barney. See you soon, okay?
Bye-bye. Bye. Barney is just joyous to have, and we love him to bits. He's having a really good life here, and he seems to be really enjoying himself.
Eight-year-old Eddie was brought in for surgery to remove a tumour, and now he's recovered from the anaesthesia, owner Sarah can take him home.
Well, Sarah, you must be dying to go and see Eddie. Well, let me just tell you, I was allowed to be in on the operation, and it was so amazing. First of all, he's lovely and toasty warm on a sort of electric blanket, and he was lying on his back, by now asleep, snoring, and he had his paws out. So I held his paw and tickled him. I mean, he was gone. He was having a fantastic time. So he's really good. And now you're desperate to get him home.
I am.
Yes.
Hey, baby. Hello, darling.
He has been a superstar today.
Hello, sweetie.
He's been great.
Hello, sweetie. Oh, look at you. You're a bit dozy, aren't you?
A little bit sleepy.
A little bit dozy.
So, his little wounds under here, it's got a little dressing on over the top.
Okay.
And that dressing, I would try and leave that on. That probably won't last very long.
Okay.
He's hairy, it will fall off at some point. When it falls off, that's completely fine.
Okay.
So I would just leave it off once it's fallen off.
Well, you're on your way home then. He's a good lad. He's a good lad. I hope we see you again soon. All happy and smiley.
And he's got a little bravery award.
Oh, the Grovet Patient Certificate. Bravest patient.
He's definitely been our bravest
I
patient.
mean... Son, have a look at that. That's yours.
You're so
Oh, that's
proud.
lovely. Awarded to Eddie with a heart. Right, off you go. Go and love him. And you need a cup of tea.
Yeah.
Eddie is heading home, but for Sarah, it's the start of an anxious wait for the test results.
Hello? Oh, hi there. It's James phoning from the Grove.
4 days after James took a blood sample from diabetic cat Arthur, he phones owner Karina with the results.
It has come back quite elevated. So his reading is 454, which is sort of just over the top end of the reference range for a cat that would have sort of enough of a control over the diabetes. But then the flip side of that is then I look at the graphs that you've sent through. Some of them are dropping actually quite worryingly low. If we had the blood result that we've got and the graphs weren't dropping down into the red, my instinct would be to push his insulin dose up slightly, but that feels a bit risky with looking at how low he is dropping at certain periods in the day. So it is a little bit of a head scratcher, and I kind of wonder whether it would be a good idea to get a specialist involved at this stage to give you some advice on where we should all go next in terms of dosing and things. Does that sort of feel like something you'd be quite keen to do, or?
Well, yeah, I mean, we'd want to do whatever we can to try and get him.
Yeah, I agree. All right, I'll arrange that, and then we'll go from there.
All right, James.
Okay. Vets basically work very similar to doctors. So I'm the equivalent of Arthur's GP, and now I want to bring in a consultant. So somebody specialising in feline medicine who can just sort of help us out a little bit and see whether we might be able to tweak his dosing or change things altogether and basically hopefully get his diabetes under control.
At home, Arthur continues to have regular injections of insulin.
Arthur brings so much to our life. He is a very loving cat. He likes to be around people. You see him sat at your feet just quietly and will just sit there for hours, really, in your company.
Karina and her husband Derek adopted Arthur 2 years ago from Hollyhedge Animal Sanctuary on the outskirts of Bristol.
I mean, I do like all animals, but I have always had cats from growing up. He really pulled at my heartstrings, and it was the idea of having a cat from a sanctuary, I think, that did appeal. We were discussing it together, the two of us, myself and my husband, and then, yeah, we finally decided that we'd like to try and adopt him, and contacted Hollyhedge Animal Sanctuary.
The work of this rescue centre for cats and dogs wouldn't happen without the dedicated staff and volunteers.
Good boy. Our team are very special. We're very lucky to have the staff and the volunteers that we do have here. Everyone that's here really does care, and they put in a lot of effort to make sure that the animal's day is the best it possibly can be.
The assistant manager here is Amber Hawkins.
They have a lot of love to give. They need someone to care for them. And when we get to see them go off to a new home, we absolutely love it.
The centre is often full to capacity, as some people are unable to meet the costs of keeping a pet.
We have had quite an influx of cats coming in recently. Our cattery is pretty much full to the brim at the moment. A lot of cost of living crisis is meaning a lot of cats are needing to be rehomed. It's never the cat's fault that they end up here, bless them.
Hollyhedge finds new homes for around 800 animals every year. Chair of the trustees for the charity is Richard Baker.
When the animals were adopted, it's a bittersweet moment because obviously we've grown very fond and very close to a lot of the animals that are here, but we always know that they're going to go to a better place and we can't look after them forever. And everyone that's adopted frees up a place for us to rescue another one.
When cats and dogs first arrive, a vet gives each animal a medical check.
Each cat has their own space, and in each pen we have a water bowl, food bowls, loads of bedding, lots of toys so they can play with things.
Some animals only wait a couple of weeks before being rehomed, while a few can be here for a year or even longer.
This is Fifi. Fifi's 18 years old, very vocal, loves his food. Do you want to go out, darling? Come on in.
The centre's cat garden is a special place for these well-cared-for felines to get some fresh air.
Mulray, he is a 2-year-old cat from Mauritius. He absolutely loves our garden, loves playing, loves running, loves the sunshine when it's out. He loves a cuddle, he loves a run, and he loves his food. And he's just a really sweet boy. He just needs a really loving home that's able to give him everything that he needs.
Alongside its staff, the Animal Sanctuary relies on a team of volunteers like Helen Marie, who helps with the important work of cat cuddling.
If they've had a loving home, they can come in and sort of settle pretty well. But if they're maybe from the street, if somebody's died and they've been out on the street for a while, it takes them a while to decompress. So having human company in here and just interacting with them all the time, then it's really good and it brings them around quicker and then we can rehome them quicker.
Good boy. Right, we're going to stay there.
One of the latest additions to the rescue centre is Dougie.
Dougie is a Labrador cross collie, so he's very intelligent, a lot of enthusiasm, as you can see. He's super, super smart. He would love someone active. He loves company, would love to be out and about all day. What we're hoping for him is that he'll find the right person, he'll find the right home that will give him what he needs. An absolute wonderful life. You're such a good boy. Good boy. Want one of these? Dougie! Yay, good boy! Come on. Good boy! Anyone that's thinking about adopting is definitely a really rewarding thing to do and gives a dog or a cat a lovely home.
Oh, I thought we were here about my allergies. No, it's fine. It can be about you.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Stung by a bee. Don't judge me. It'll probably happen again.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
In Bristol, the veterinary team treats a wide range of pets. During the first year of a dog's life, it's important to visit the vets for routine checks and treatments.
So, little Mila, here she is. The puppy with the best haircut in town.
Mila, a 7-month-old Cavapoo, has come for worming and flea treatment, accompanied by her owner Aaron and his children.
So what we'll do, she's obviously in for her worming tablet today, isn't she? But with that, we'll just give her a quick check over as well and just make sure that I'm happy that she's fit and well. So, Fern, would you mind distracting from
Of course I will. Hello, darling.
Have a little feel of her here.
Yes. Hello, lady. Hello, lady. She's so beautiful. So, you're obviously very in love with her. And we've got Bailey and Bo and Jay. Very nice to see you.
The worming and flea treatments a dog needs are based on your local area. Living in this residential suburb, Mila will need a monthly dose, which, believe it or not, is tailored to her weight.
Being such a young puppy, each month that we're seeing her, she's putting a little bit more weight on each time, so we just want to make sure that the dose of worming that we're administering is the right amount.
I didn't realise that. So you're weighing a doggy every month before the worming pills.
It's quite important to make sure that we don't either under or overdose when it comes to obviously giving any medication. But with young puppies especially, it is a good idea to have quite a thorough worming and flea treatment because they are more prone to picking up worms. So adult dogs, when they do pick up worms, they can often, kind of cope with them a little bit better. With puppies, because if they do pick up worms, it can actually be a lot more concerning to their health. So we would otherwise recommend to do them at least every month for most of their flea and worming treatments. Right.
I'd like to see a masterclass in giving the tablets.
That is a challenge I will accept, and
Yes.
we will have to hope that Mila is on my side. So I'm just going to nip down here and grab these scales. Okay, so maybe somebody might be able to just pick Mila up for me. Yeah. Oh, any excuse for a cuddle. No, Just give me 2 seconds.
She's lovely and warm, isn't she?
Right, let's pop her onto here and see if she'll sit. Hello. Oh, straight off. Okay, I know what we'll do. I know what we'll do.
A treat on the...
Treat at the front end.
You're
and
doing
then
really,
that
really
might
well.
Settle us onto here.
Oh, just hang on a
There
second.
we go, beautiful.
Lovely.
So, 7.4 she is this time.
Oh, nice.
Yeah, so she was about 6 last time, so she's definitely put a bit of weight on there,
Good
which
girl.
is good.
Yeah, she seems a bit bigger.
Let's have a look. I'll just add that onto her record. But also, as well as coming down for the worming tablets, this is a great way to bond her to the practice. So, we're only giving her a tablet today, but also loads of treats. So hopefully, what we're doing each time that she comes in is just making her realise that the vets is not a scary place. Nice things happen. We give her nice, tasty treats. And then if she does need to come for something maybe a little bit more involved, she's sort of, quite used to coming down here.
Yes.
Right.
Oh, yeah, more treats.
Now, Mila, don't embarrass me.
So this is the tablet.
So this is our tablet. So this is going to treat her for things like ticks and fleas, but also lungworm and roundworm. So some of the sort of more nasty parasites that we can see in our pets. But there are also some quite nasty diseases that not only can affect pets, but in theory can also spread to people too. So there's a sort of a family protection here as well as just protecting the puppies.
So if we can all stay well.
Yeah,
yes.
absolutely. Hopefully, Mila is going to think that this is just another treat. So let's see. Ready?
So you popped it into a little piece of a treat, the pill, and
what's she taken? Has she taken a treat or just the pill?
both have gone.
Oh no!
Oh, no.
She knows. Let's see.
You gonna eat it?
No, she got it.
It's food, sort of.
It's a good girl.
Good girl, Mum.
Look at that.
That's the one. That sounds like a good crunch.
Yes, it's gone.
Beautiful.
Well done.
There we go.
Well done, darling.
I'll just add her weight onto the record and just update a couple of things. Have you got her insured?
Yeah, she's with Pet Plan.
In Pet Plan, okay. I'll add that to your record as well. Lovely. Right, I will put the tablet up, and I think that's us all done for another month. So we'll see you back next month, do the same again.
Okay.
But yeah, she's looking great.
Thank you.
Yeah, no worries.
James has handled one of the younger patients at the vet's. Amy, meanwhile, is focused on an equally cherished older pet. 2 days after the lump on Eddie's neck was removed, his results are in.
A bit nervous. Hopefully it's good news. Yes, which it is. That's really good news. So it's something called an infundibular cyst, which is a non-cancerous kind of dilation of the hair follicle. So now that we've excised that lump, it's completely curative. So Eddie is A-OK. He's going to be great. So I'll just give Sarah a ring. She'll be really excited to hear. So yeah. Hi Sarah, it's Amy calling from the vets. Hiya, it's really good news. So don't worry, he's fine. So nothing cancerous whatsoever. So we can not worry at all. So that's all we really need to concentrate on now, is just getting that wound to heal nicely. And there's no reason why that shouldn't. Presumably he's okay and everything's okay from your end? Good. I knew you were worried, so I just wanted to get those results back to you as soon as we could. All right. Thanks, Sarah. Take care. Bye. She's delighted. Obviously, there's a lot of history with Sarah and Eddie, so I'm really pleased for her that that's come back as benign, which is always the best outcome. Sharing good news is always a relief. It's always the outcome that we want.
It's okay. It's okay.
Next time inside the vets, James has to figure out how to treat a cat with a painful injury.
Oh, he's so handsome, isn't he?
And we meet the pups that will change people's lives forever.
Oh, she's doing so well. Calm walking from them all as well, which is brilliant.
You can't swagger when you're walking with a white stick. It just doesn't look right. But you can when you're walking along with your dog.
I'm loving this place. Fern Britain Inside the Vets, brought to you by Pet Plan.
See
yes.
in our pets. But there are also some quite nasty diseases that not only can affect pets, but in theory can also spread to people too. So there's a sort of a family protection here as well as just protecting the puppies.
So if we can all stay well.
Yeah,
yes.
absolutely. Hopefully, Mila is going to think that this is just another treat. So let's see. Ready?
So you popped it into a little piece of a treat, the pill, and
And what's she taken? Has she taken a treat or just the pill?
both have gone.
Oh no!
Oh, no!
She knows. Let's see.
You gonna eat it?
No, she got it.
It's food, sort of.
It's a good girl.
Thank you, Mum.
That.
That's the one. That sounds like a good crunch.
Yes, it's gone.
Beautiful.
Well done.
There we go.
Well done, darling.
I'll just add her weight onto the record and just update a couple of things. Have you got her insured?
Yeah, she's with Pet Plan.
In Pet Plan, okay. I'll add that to your record as well. Lovely. Right, I will put the tablet up, and I think that's us all done for another month. So we'll see you back next month, do the same again.
Okay.
But yeah, she's looking great.
Thank you.
Yeah, no worries.
James has handled one of the younger patients at the vet's. Amy, meanwhile, is focused on an equally cherished older pet. 2 days after the lump on Eddie's neck was removed, his results are in.
A bit nervous. Hopefully it's good news. Yes, which it is. That's really good news. So it's something called an infundibular cyst, which is a non-cancerous kind of dilation of the hair follicle. So now that we've excised that lump, it's completely curative. So Eddie is A-OK. He's going to be great. So I'll just give Sarah a ring. She'll be really excited to hear. So yeah. Hi Sarah, it's Amy calling from the vets. Hiya, it's really good news. So don't worry, he's fine. So nothing cancerous whatsoever. So we can not worry at all. So that's all we really need to concentrate on now, is just getting that wound to heal nicely. And there's no reason why that shouldn't. Presumably he's okay and everything's okay from your end? Good. I knew you were worried, so I just wanted to get those results back to you as soon as we could. All right. Thanks, Sarah. Take care. Bye. She's delighted. Obviously, there's a lot of history with Sarah and Eddie, so I'm really pleased for her that that's come back as benign, which is always the best outcome. Sharing good news is always a relief. It's always the outcome that we want.
It's okay. It's okay.
Next time inside the vet's, James has to figure out how to treat a cat with a painful injury.
Oh, he's so handsome, isn't he?
And we meet the pups that will change people's lives forever.
Oh, she's doing so well. Calm walking from them all as well, which is brilliant.
You can't swagger when you're walking with a white stick. It just doesn't look right. But you can when you're walking along with your dog.
I'm loving this place. Fern Britain Inside the Vets, brought to you by Pet Plan.